core component of casework, where you talked about individual like a client, then you talked about the problem, that is the issue the client is facing. You talked about the environment and the methodology that's the strategies and intervention that we can use as a social worker.
Okay. Any other contribution? Any other contribution to the discussion we had earlier? Hello? Do we have any other contribution for those of us in the class? Hello?
We can hear you, sir.
Yeah, I'm asking any other person to give update.
Like we were just two in the class that day, sir.
Oh, and
yes,
the others
sir.
in this back?
They would have, maybe they would have listened to the recording, sir.
Okay, they should say something.
All right, sir.
Okay, in the absence of something, I think let me just move further to refresh our mind that social case work management is a social work process that involves coordinating, facilitating, and documenting social services and support to meet the holistic needs of individuals, family, or communities. So what I'm saying in essence is that case management in social work encompasses a collaborative and client-centered approach, which usually is aimed at helping vulnerable population or individual access the necessary resources, support, and intervention to improve their overall well-being and achieve positive results. So when we say casework, the casework usually involved clients and workers, workers and clients, workers and client family, workers and clients and other significant individual in the life of the clients. And oftentimes we know that the social work practice requires painstaking listening with professionalism to clients' cases, and then deducing from the client's cases matters of importance to the case at hand, and then designing a template of approach following a standard operational procedure to deal with the cases, given the content of the cases has been explained. So the issue here is very clear that each client comes with the uniqueness of their own issues, and these issues are where the social workers is concentrated on. So we will say that if you are looking for the best social work case management software, I'm not very sure that we really have a program software that solved the problem of a client individually. But there are basic parameters required to be used, because oftentimes in social work case practice, the clients also have to come with their own unique presentation, and every problem or challenges a client presents, the solution is also found within and around that very client in particular. I do not also have seen or heard of any case that the client presents, and the solution to that client problem is found very far from that client. Is that correct?
Yes, sir.
So, for instance,
Yes, sir.
we look at what could be the significant differences between social work at large and a case management in particular. So I said that sometimes a case manager is, not even sometimes, a case manager is supposed to be a particular professional that specializes on a specific aspect of dealing with individual cases. While the social workers refer to the term of a broad definition that encompasses both the caseworkers as well. But a caseworker is a person whose uniqueness is in dealing with individual cases on its own merit, taking into cognizance the notations, noting, and the presentation of each particular client. Like I said earlier, that no client's intervention plan is actually seen outside the client themselves, because it's quite very often that when the client presents what the problems could look like, within that client's presentation is where we also will find where the issues lies. So it could be clear to all of us that the difference between social work and casework is that social work is broad encompassing, while the casework is a training that actually make an individual to focus directly on the client itself and then deal with the case one after the other. A lot of us have dealt with casework, and we have dealt with also the broader social work practice. At this level, the management of skills, the management skills has to be highlighted. The social work case management skills has to be highlighted to help us sharpen our skills and in practice their competence. I will say that the skills expected would include assessment and evaluation. You will agree with me very well that if assessment is not properly done, it is difficult, an evaluation of a case is difficult to arrive at the intervention plan that reacts effectively to the situation of the client. That is to say that the social workers involved in the casework must have the patience, have the ability to communicate effectively, draw line between issues that are murky or dark or are looking shady, and requests that lies are thrown on those cases from the client perspective, and then evaluate everything that is being communicated. Because oftentimes the client give account of what has happened, and the accounts are also sometimes not necessarily the correct account of the situation. You know very well that in medicine, medical practice, some of us have had the term that good prognosis give good diagnosis. So if you are unable to tease out the reality of the accounts of what actually happened and what the experience of the client and evaluate as appropriate, it's quite likely that the intervention plan will also be in error. So we also have what they call planning and goal setting as a skill required here. You need to be able to plan well. Plan for the planning is a broader term in this case. You plan for the environment, plan your communication, and plan your approach to be able to get exactly what could help the situation. I want to tell you that when we talk about casework, there are casework with elderlies, you have casework with youngsters, you have casework with children or toddlers. So in the case of planning for this case assessment and evaluation, the scenario and the environment are also quite different. Where we are dealing with children, it could be very, very obstructive or maybe not productive to have a client, let's say a social worker who is a caseworker, sit on the chair, executive chair in the office, and place a child on the chair at the other side and begin to interview, talk with the child to be able to get certain information, to design an assessment and evaluation, to do other work. So the planning starts from the environment. You look at the immediate environment. What case am I having in my hand now? For instance, also, you have a case of family or family issues in your hand, and you are a caseworker. You are sitting in a luxurious office. And of course, on your table, there's a picture. Are you with me?
Yes, sir.
Okay. On your table, there's a picture of you and your husband, or you and your wife and children happily married. But we are handling a case of a broken home that is being necessitated by childlessness. So at the point of the planning, you may be sensitive enough to know that such photograph need to leave your table, such pictures and things that could make the person look at it and got sunk more into depression could also leave your table. So that's what I mean by the environmental planning. And if you have seen the client before or you are expecting the client, you should know what kind of setting in terms of table, chairs, and the rest that could make it work. Then if your case will require recording, devices should be made available, but then you don't record without letting the client know unless it is a forensic social work practice. And again, what goal do we want to achieve? We need to be set as well. What do we want to achieve? We want to, for instance, we want this child to rejoin the family. For instance, we want to settle a case, we want to do this and so on. So that goal will be set. The planning also take its cost. Materials required for your work is also put into your plan. These are the skills that is expected. There is a way environment will be planned and set, and it will yield a better result. On the same case, the environment is also planned and set differently, and the result cannot be achieved. So these are things we need to understand that the skill will also have to be there to enable us to achieve the result. Then we talk about resource and coordination. In every business of service delivery, resource is important. And when I mention resource, I was talking about setting your table, setting your chairs, setting your office to meet with individual clients. Of course, it simply means that the social work office or social work workstation it doesn't have a mono setting. It has a setting that can allow you to adjust to fit individuals and also fit with the specific case at hand. So there must be the resources there to do the work, resources to do home visit, resources to also go around to make sure that things you need to confirm are done. So ab initio, this plan could also help to make sure that we don't get halfway and then got stuck.
Hello, hello. I can't hear again. Oh, all right.
Please
I too.
give me
I
1 minute.
talked
I'll
to
be
you.
back with you.
All right, sir.
All right, sir. All right, Prof. Thank you, sir.
Great. Sorry about that. So I was trying to say that there is more on the skills expected. I mentioned assessment and evaluation. I also talk about planning and goal setting. I talk about resource coordination and allocation. These are the skills as expected. In the assessment, I talk about it has to do with questioning, asking logical questions, questions that are direct, questions that are leading you to answers that you also need. Planning, I mentioned that you have to set your planning revolve environment, materials, and putting things in shape. Then resources, because you know that without resources, you cannot plan well. You cannot also do a lot of what you do. So at the time where you are done with, am I on that? Am I hard? Hello?
Well, yes, sir. Yes, sir.
Okay, so at the
Clearly, sir.
time when you
We
are
can hear.
trying to do your case plan, you don't shy away from the aspect of resources, because without putting the resources that will be required on ground, the case might not also be very, very effective. Then communication and collaboration comes out here as a very key object here. You know, your level of communication is very important. Communication means your ability to express yourself and be heard, be understood, and the desired answers are being given to you. That is just what I can say communication is here. But in social work case practice, communication comes in two directions. You have the verbal communication, you have the non-verbal communication. The verbal communications are actually the communication that you use voice. You talk and people heard using a voice language. And then why nonverbal communications are semantics, using signs and using actions and colors and symbols. And this must be well mixed by a good caseworker. A caseworker must understand the fact that when you are smiling, the smiling should mean something that is direct, not something that where you are something is not it's difficult to understand, or something is quite annoying and you are smiling. When you smile to a client when something is quite annoying, you may send a wrong signal, and then you get wrong assessment as well. If something is not pleasing, you can maybe take your face a little bit to collaborate the fact that you are not pleased with what you are hearing, or you are not pleased with the circumstance, because the client not just listen to you, the client also don't just only listen to your voice. The client also listen to your non-verbal cues. So it becomes very important that a caseworker understand if her voice is usually very high, what that high voice could mean to the client. I know some of our colleagues, we say that, look, this is my voice. This is the way my face is. This is the way I talk. In fact, this is the way I approach issues. Social case worker do not have a fixed way of talking, do not also have a fixed way of facial expression, do not also have a fixed way of acting or doing things. Whichever voice level you want to choose must depend on the case at hand and what you want to achieve. Whatever you want to wear on your face, smiles, frown, and so on, you should actually be able to communicate to the client to give the client a true position of where you are. Say, for instance, and somebody told you that he may be a part of the case assessment. Somebody is talking to you, a client is talking to you, and say, "Oh, when I came back, my wife I didn't, or my husband, whichever the spouse, my spouse just slapped me." And I say, "What have I done?" He slapped me again. Before I talk again, he pushed me. And for a social worker, you smile or laugh. I want you to tell me how that can affect the client's continuation in that case reporting. Can you say something?
The client will feel bad that probably the social work case or his scenario or story.
Exactly. The client may feel bad, or may feel uncomfortable, or may look foolish, or may look as if you don't have any concern about the case. But you are not to cry when this kind of a story is being told. You can just put your face at normal, and perhaps if you want to come and say, really? He really slapped you? So that's okay. Please go ahead, because that is not the end. You are not judging. But then you must have the the clues that encourages the clients to go ahead with you. I told you that communication is in two ways here. You have verbal, you have non-verbal. Earlier, when I talk about planning, I mentioned pictures on your desk. It's communicating. For instance, I'm a client, I come in to tell you the problem I have, challenges I'm facing with my wife and so on. I come in, I see your happy married photograph, you and your husband or you and your wife on your table, hang over your offices, and the number of your children smiling, their photographs and so on. The first thing that will be in my mind is that this person may not understand what I want to say. I'm not sure he will understand the kind of thing that I'm going through. So definitely those things are also communication tools. So the social worker or social case worker that is dealing with cases of this nature might understand that you have to drape your office. Draping means placing things on table, setting the table, using putting on your desk or in your room whatever you feel is going to help the case. So because you don't restrict the client's eye, you don't restrict the client's sense of smell and so on. So the client, all these are communication languages that the client actually use to substantiate your intervention. So the communication is very, very important, very cogent. Like I am saying, communication and collaboration. You need to communicate effectively and don't allow your words to be contradicted by things and maybe other objects on your table or your sign language, your gestures. Why you say, oh, this is pleasing, and your face is as hard as stone. Why you say, oh, this is a joke, or let's say, well, what has happened is not so serious. It can happen anywhere. It can happen somewhere. It's not something to be taken with a pinch of salt. And your face is as hard as anything else. So you will learn to make sure that your facial expression, your body language goes in consonance with the verbal communication or languages you are using. This helps to give the client a sense of fortification, a sense of feeling at home, a sense of protection as well. So I also move to the next level of skills expected, which I call crisis intervention. This skill is very important because case workers do not have work to do if there is no crisis or something close to crisis. Are we right?
Yes, sir.
Yes, sir.
Because when you have clients in their perfect situation and condition, I'm not sure they have business with a caseworker. So we need to develop that skills to understand crisis before the crisis happen, to even pick out crisis from the statement, crisis from the story being told, crisis from the situation we are seeing at hand, and then be able to intervene effectively. We also have to develop our skills in cultural competence. A social worker does not have a culture. I'm sure we know that. Hello?
Yes, sir.
Yes, sir.
Why won't you have a culture? Why won't the social worker have a culture?
You have to have the culture
Because
of the client as they come.
Exactly, because your culture
because
is
you
useless
don't
to a
want the
client.
yes, you don't. There must not
Your
be bias
culture,
with your own
your
personal
personal
culture
culture
or
is useless
religion.
to a client. A client is not interested in the culture, is interested on his or her own culture. And that is why the initial interview will take you to the client's culture, cultural inclination, and so on. And issues can only be solved along that line and not along your own line. So the cultural competencies requires that we develop our skill in understanding the cultures of so many other people, how they do things and how their things are being done. And our business is out of the range of talking about judging the people's culture, that this culture is like this culture is like that, this culture is that. In fact, a social worker or specifically a case worker that goes into that is going to fail. So we also part of the skill required for case management is documentation and recording. We should be able to document, we should be able to record effectively, we should be able to make sure that what has been discussed, every discussion, every actions taken, every observation made are properly documented and therefore recorded for keeping. Recorded, I'm not just talking about voice recording. Writing is a record. Then snapping is also a record, but there must be a sure way of documentation to be sure that we are not treating cases based on our feelings. When what you have done as a caseworker is not found in the case taking, it's not even found in the client's complaint, it's not even found in the supportive or significant individuals to the client's comments and explanations. It simply means that what we are doing is off the case. Then we also understand, I know you know this very well, there's this aspect of ethical decision making that a good a caseworker must have, it must be ethical, and decisions you want to take must also fall along the line of good ethical conduct so that you may not breach some gaps, you may not breach or cross some borders, so overstep some lines, and therefore become somebody that will be sued or somebody that will be detested by clients in the course of doing your job. So the ethical consideration is also a skill that we need to uphold. Then finally, I talk about evaluation and outcome measurement. Among all these I've said, after all this said and done, a client is expected to talk about the outcome, to be able to discuss the outcome, to also be able to operationalize the outcome, because it is when this is done that we can talk about the case management. Then when a case has been managed, it becomes important to measure to what extent has the case being managed got close to the goal of what was expected at the beginning of the case. So when you evaluate when you evaluate and you have the outcome, you also have to be able to measure. It is in measurement that we are going to understand what gap exists and then redesign a follow-up measure to be able to close the gap. So in a nutshell, case management practice, to streamline case management practice, social workers can benefit from utilizing case management skills to apply to their clients to get effective outcome. And as I am trying to tell you about these skills, sometimes it's not also it's not also a strong possibility that all I've listed is a compacted in one individual. By so doing, role sharing becomes very important. You remember there's a class I had, I don't know whether it's with this set of the student, that I said that some of the cases, some of the issues I've come across is about a social worker owning a client. When a client is assigned to you, you seem to own that client, deal with the client from the beginning to the end. I want to think that we should be able to understand where each and everybody has strong competence, and then we can also refer or bring in other colleagues to deal with some part of it that is very important. It's not out of place for one other person to take case, listen to the client clerk, and then document the issues, then take it for analysis, and some other person is asked to follow up. So we might, but when we know the importance of these skills and how it applies to the work we're supposed to do as case managers, we begin to value ourselves, begin to understand that there may be need for another person to do one part and this one do one part as well. Then we put the parts together and evaluate. From there, we can give the client the best of services the client is expecting. Do you have any question?
Yeah, sir, thank you for the brief, sir. I just want to ask, sir, you talked about case manager as a person that is dealing with a particular person that have a particular client that have a crisis that we have to intervene into. And you've taught us about the skills to use in getting this intervention. You actually stop at the referring of sharing part of our job with other colleagues or referred appropriate because all the skill might not be comparison into one person. Very understandable.
Exactly.
I just want to ask, yes, sir. I just want to ask if the same job with case manager is the same job with social worker.
Yes, a case manager is a
Just
special.
or another person who is not a
No, no,
social
no.
worker can
A
still be
social
a
worker, a
case
case
manager.
manager,
Because,
a
sir,
case
sorry, sir.
manager is. I'm trying to explain that a case manager is a social worker who is trained
Okay.
further on managing cases, dealing with individual cases.
Yes. I just want to ask where I work. I see some other professional like clinical psychologists claiming to be social worker, psychiatric nursing claiming. I mean, sorry, claiming to be case manager. Please, pardon me. Claiming to be case manager. I'm always very confused about this, and I don't want a kind of boundary conflict where I will
Okay.
be able to. They will think that, oh, is it because he's chartered? That's why he's doing that. And which I've been going through a lot here because I'm the only one presently chartered. And if others, not in my own department, they will talk to the extent that the act we are using, how are we getting all these things, that NASO have not gotten this. So I'm at the borderline, sir. Yes, sir. Thank you, sir. Hello? Hello?
Okay. What I want to say clearly here is that it's not only
Yes, sir.
social workers, case workers.
Oh, thank you.
Great. You have psychological case workers if it's psychological problem. You have psychiatric case workers. If
Yes,
a
sir.
social worker conduct an evaluation and understand that this is a psychological case, psychologists can be asked to take that case. That's a clinical psychologist.
Oh, thank you, sir.
But a
Thank you,
clinical
sir.
psychologist also will know what work comes back to the social worker. A psychiatrist also is a case worker because he can take the patient one-on-one on psychiatric cases.
Thank you. Okay.
But
So we
but
must
one thing,
concentrate only on the social work
in your
area.
area, the social aspect of the client is where a social worker has issues. But when the client is speaking in tongues, cannot coordinate, cannot do this, another case worker has that case, not you. But when it has to do with the social aspect, family, well-being, and other
Culture,
issues associated like that,
social.
that is for a social worker. But over time, we
Thank you,
have
sir.
not been able to differentiate,
Exactly.
to put things in a proper perspective. And that is why I'm still talking
Hmm.
about that. Even within ourselves as social workers, some of us don't recognize the skill of others. Say you're a
Hmm.
social worker, I'm a social worker, there's something you know and I don't know. There's something I know you may not know. There's something you know I don't know. But I should know what you know. So when they get to that point, I don't disturb myself. I push the person to you.
Hmm.
And
Sir,
when
I
you
want
get to
to have
the other
cognitive
point,
behavioral therapy. Cognitive
sorry?
behavioral therapy. Is it part of cognitive behavioral therapy, CBT, sir? Is it part of our
No.
tools as a social worker or psychologist?
If it has to do with the social aspect, if it affects the social functioning of the person, yes. Because behavior you are talking
Okay.
about can be spoiled by so many things. It can be the brain, it can be something
Can
else,
be the environment.
it can be the
Environment.
environment, it
Yes.
can be anything else. But
School.
where it
Home
is
visit.
medically, pathologically inclined, it is not your case.
Thank you, sir.
You
Pathologically.
know, when a person is showing signs of
Pathologically.
problems, a lot of things can lead to that.
No.
It can be from the
Oh.
CNS, it can be from other, but when it comes to other things outside the social milieu, you are out of that case.
Hmm.
I hope you
Any
understand me.
Yes, sir. Any case
You can
outside.
also take in a case wrongly. But when you now discover that, oh, this case is not mine, you refer. You don't stay on a case that is not yours. You don't also stay long on a bad case. Because no matter how you want to handle psychiatric case, it will be bad on your hand.
So referral is the key.
No, you
Thank
should
you,
know
sir.
your boundaries. That is the key.
Yes.
Okay, any other question?
Yes, sir.
Okay, go
Sir,
ahead.
thank you so much for the lecture, sir. So sweet. You talked about um having environmental plan for our clients even before they arrive, that we can clear everything that will not make the work, or that will add negative emotion or whatever to our clients, if I'm right. Then you now mentioned that we should, as one of the skill, that you mentioned resources, and I don't seem to get that particular aspect of it, sir, the resources.
Okay, resources include money and materials you will need.
All right, sir.
Sir, I want to include, sir, resources is money, materials, the family, everything that will make that case to be successful, all the material resources you needed, including the guidance of the family and the personnel, is part of the resources. I permit to include that, sir, if it is logical.
All right, sir. Thank you.
We call it resources per capita index. Hello?
Yes, sir. Thank you,
Hello?
sir. Hello, sir.
Uh, I can't hear Professor again. Hello?
I can hear you, but maybe
Where I
network.
stopped, network. I said resources per capita index. That
Yes,
is
sir, I
all
heard
the
that.
materials. Okay. It's not just
Thank you.
money done. Yes, thank God.
All right. All right. Thank
You get that from your assessment and evaluation of the patient. What and what you require to make this case to be successful.
you. Successful. At the beginning
Yes.
of during the assessment.
Yes, you get, he said the case is peculiar and you must approach it individualistic. The case of
Yeah.
one
Yeah.
A is different from B. So that is why we don't have software for case management, as he said.
Yeah.
No,
So
we
that
have
is why I brought
software.
that.
We have
Oh,
software for case
Prof,
management.
you
Sorry,
are
we
in,
have
sir. Thank you,
software.
sir.
Yeah, we have software for case management. But the
Oh,
software need to be applied by you.
yes, yes. That's
You
what I
must have
meant by individualistic.
you must have the competence to be able to
Oh,
manipulate the software to see what you
yes.
want it to see.
Software.
It's not a straitjacket software that can go and solve family, solve this, solve that, and solve that. If you check online, they are. But
Okay.
it's not to say that the software will solve the problem without you. That's what I'm going to say.
So, okay. You still need
Yeah,
human social work, human effort
exactly.
to
Experts.
apply it, yes,
Sure,
expertise, to apply it to
sure.
different cases. Yes, thank you, sir. This is interesting. Thank you, sir.
Yeah.
Yes, sir.
Any other question? Any other question?
I think it's self-explanatory and we enjoy your lecture.
Okay, so I will
Maybe we
send the
should proceed.
materials across.
Okay, sir.
Sorry for taking you off your work. So have a good day. Thank you so much.
Thank you, sir. It was
Thank
so
you.
sweet,
Thank
sir.
you, Prof. Thank you, Professor.
Thank
Thank
you.
you, sir. Yes, sir. Thank you, sir. My able HOC, I agree to.